Hello dear learners, my name is Muna Jones. Today we are discussing substance use disorders or disorders due to psychoactive drug use. Definition: these are conditions arising from the misuse of alcohol, psychoactive drugs, and other chemicals such as volatile substances. Why it's important to have a good knowledge of substance abuse in psychiatric practice. Relevant to the assessment of a patient with acute confusion on a medical ward. A suicidal patient in the accident and emergency department. The elderly patient whose self-care has deteriorated. The troubled adolescent. A disturbed child who may be inhaling volatile substances. According to the DSM IV and ICD-10 classification systems, substance use disorders are categorized as follows: substance use disorders, or disorders occurring due to substance use. Intoxication. Abuse, harmful use. Dependence. Withdrawal states. Withdrawal state with delirium. Psychotic disorders. Amnestic syndromes. Mood disorders. Anxiety disorders. Sexual dysfunctions. Sleep disorders. Different types, classes, of substances that people use. Alcohol. Amphetamines. Caffeine. Cannabis. Cocaine. Hallucinogens. Inhalants, volatile solvents. Nicotine, tobacco. Opioids. Phencyclidine. Sedatives, hypnotics, or anxiolytics. Polysubstance, multiple drug use. Other. 1. Intoxication. Intoxication is seen as a transient syndrome due to recent substance ingestion that produces clinically significant psychological and physical impairment. These changes disappear when the substance is eliminated from the body. 2. Abuse. Abuse or harmful use refer to maladaptive patterns of substance use that impair health. 3. Dependence. This term refers to certain physiological and psychological phenomena induced by the repeated taking of a substance, such as a strong desire to take the drug, progressive neglect of alternative sources of satisfaction, the development of tolerance, a physical withdrawal state. 4. Tolerance. This is a state in which, after repeated administration, a drug produces a decreased effect or increasing doses are required to produces the same effect. 5. Withdrawal states. These are symptoms and signs that occur when a drug is reduced in amount or withdrawn, which last for a limited time. The nature of the withdrawal state is related to the type of substance used. 6. Psychotic disorders. Substance-induced psychotic disorder is an illness that is characterized by hallucinations and/or delusions occurring as a result of substance-induced neurotoxicity. Psychotic features may occur during intoxication and withdrawal states or develop during harmful or dependent use. 7. Amnestic syndromes. Alcoholism. It is habitual alcohol consumption that is deemed excessive in amount according to some arbitrary criterion. Delirium tremens. Acute confusional state secondary to alcohol withdrawal. A medical emergency requiring inpatient medical care. Occurs in 5% of episodes of withdrawal. Onset 1 to 7 days after the last drink with a peak incidence at 48 hours. Risk is increased by severe dependence, comorbid infection, and pre-existing liver damage. Signs and symptoms. Clouding of consciousness. Disorientation in time and place. Amnesia for recent events. Marked psychomotor agitation. Misinterpretations of sensory stimuli which are usually visual. Visual, auditory, and tactile hallucinations, characteristically of diminutive people or animals. Lilliputian hallucinations. Worse at night. In severe cases, heavy sweating. Fear. Paranoid delusions. Agitation. Suggestibility. Raised temperature. Sudden cardiovascular collapse. Severe agitation. Restlessness. Shouting. Evident fear. Mortality of 5 to 10%. Risk of death when it develops unexpectedly and its initial manifestations misinterpreted, EG. And a PT not known to be alcohol dependent developing symptoms post-operatively. Differential diagnosis: hepatic encephalopathy, head injury, pneumonia, acute psychotic illness, acute confusional state with other primary cause. Wernicke's encephalopathy. It is an acute condition occurring due to nutritional deficiency of thiamine, vitamin B1, leading to neuronal degeneration. This is seen in heavy drinkers due to poor intake of vitamins, alcohol calorie-rich but vitamin poor, reduced absorption, and impaired hepatic storage. Clinical features. Acute onset of tetrad may not all be present of 1. Acute confusional state. 2. Ophthalmoplegia, sixth nerve palsy. 3. Nystagmus. 4. Ataxic gait. Treatment. Admit. Assess and treat acute confusional state. Parenteral B1 replacement, impair. Prognosis. If untreated, lasts 2 weeks. With 84% developing Korsakoff psychosis. 15% mortality in untreated cases. With treatment, sixth nerve palsy and confusion resolves within days. Ataxia, neuropathy, nystagmus. Korsakoff psychosis. Amnesia and confabulation associated with atrophy of the mammillary bodies, usually following Wernicke's encephalopathy. Rare causes may include head injury, hypoxia, brain injury, basal temporal lobe encephalitis. Thanks for watching this video. Kindly share and click subscribe button for more educative content.